So smoking is harmful in the context of stroke because about 41% of our patients that come in are current smokers. And the problem with smoking is that not only does it make your blood sticky and clot more easily, it also leads to buildup in your vessels, which again lead to stroke. So if unmanaged, the buildup in the blood vessels can become narrow, and if you form clots that end up in your brain, that's what leads to a stroke.
I think most people understand that smoking's bad for them, for their lungs. I think that what people sometimes don't quite appreciate is all the other bad effects that smoking can have on your body.
So thrombosis is the formation of clots, and in the normal process, your platelets form clots in response to an injury. When you're having a stroke, your blood clots incorrectly, and a clot can form, and your circulation actually will send the clot up to your brain, and that is what causes a stroke.
Smoking's the number one thing that sets you up for an abdominal aortic aneurysm, which can rupture and kill people. And it's also the biggest risk factor for peripheral artery disease, which can cause arteries to block, cause people to lose legs, or in less severe cases even have just difficulty walking. So if somebody continues to smoke after they've developed an abdominal aortic aneurysm, it makes it much more likely that that aneurysm is going to continue to grow and that it may burst and put their life in danger. And then with respect to peripheral artery disease, continued smoking's the number one risk factor for worsening of their disease, and it can set them up for even the need for a major surgery to fix the blood flow in their legs or for an amputation. And with arteries in people's necks, the carotid arteries, it sets them up for carotid artery disease and stroke.
Cigarette smoking is the number one preventable lifestyle choice that leads to bad outcomes, not just death, but also disability. And that has a lasting effect on your life and the life of your loved ones. I think every smoker knows that it's a good idea to try to quit. The most important part of quitting smoking is to look at it as a process. Most people need to try to quit more than one time, and so you need to look at it as not just quitting smoking. You really have to look at everything that triggers your smoking. What are the things that lead you to smoking? What are the physical attributes to your habit? So are you coffee and a cigarette in the morning? Do you always get together with your friends in the afternoon for a cigarette break? You need to have partners in your quitting journey, and so all of your family and friends should be a part of this journey with you. It's really, really hard to do it all by yourself, and we're here to help. There's lots of tools that we can use to help you quit.